Okay, we are recording.
That's great. So good afternoon and welcome to today's virtual life and health industry meeting. My name is Kathleen Birrane and I serve as the Maryland Insurance Commissioner. The Maryland Insurance Administration conducts meetings with industry throughout the year, including one shortly after the close of the legislative session to discuss bills that have passed, implementation of those laws, regulations in process, and recent bulletins. The meetings give us the opportunity to provide information and to receive feedback from industry and other stakeholders. For today's meeting with the life and health industry, you can view our agenda by clicking on the link in the chat box. Before we get started, let me just go over a few housekeeping items. First, this virtual meeting is being held via the Zoom webinar platform and is being recorded. The video and sound recording will be made available on the MIA's website within the next few days. Secondly, only those individuals who received a panelist invitation and who clicked on that invitation and have the ability to be seen or to be heard. Links were sent to the individuals who requested to speak in advance. Even if you did not sign up to speak, if you wish to be heard, please let us know via the chat function. As time and technology allow, we will then call on you in turn and unmute your line to allow you to speak or try to bring you over where you can be both seen and heard. As we've all learned these days, to help ensure excellent sound quality through the hearing, we ask that you please stay on mute unless you are speaking. So as we get started, I would like to introduce the MIA staff who are in our meeting today. Let me first introduce two new members of my team, Associate Deputy Commissioner Sherry Fanaroff and my new Chief of Staff, Corey Boone. So welcome to both of them. It's their first life and health industry meeting. Also with us today are David Cooney, our Associate Commissioner for Life and Health, Bradley Boban, who is now our Chief Actuary, Erica Bailey, Associate Commissioner for Compliance and Enforcement, Joy Hatchette, Associate Commissioner for Consumer Education and Advocacy, Van Dorsey, Principal Counsel, Mary Kwel, the Chief of Life and Health Complaints, Nour Benchaaboun, who is the Director of Life, Annuity, and Credit Reviews, Michael Paddy, the Director of Government Relations, Lisa Larson, our Director of Hearings and Regulations, and Craig I, who is the Director of Communications. So as I noted, we have a pretty full agenda today, and it's available and you can access it through the link in the chat box. We're going to start today with a summary of bills from the 2021 legislative session. And Mike, let me invite you to kick us off with Senate Bill 226.
Sure, thanks. So Senate Bill 226 was an MIA departmental bill from last session that just provides the commissioner the ability to require licensees to send certain communications electronically. And then on individuals that are not licensed, if they provide an email to communicate that way electronically. So right now, we plan on issuing a bulletin before the bill goes into effect in October about what communications we're really referring to. So just keep an eye out on that. It's in the pipeline. If you do have any recommendations on something that you currently are required to send to the MIA in a hard copy, feel free to bring that to our attention. We'll certainly look into making that something that can be sent electronically. That's all I had on Senate Bill 226. Commissioner, I don't know if you wanted to add anything else, or else I'll defer to David to jump into the next bill.
Good. Go, David.
All right, thanks everyone. So the next bill we would like to highlight was House Bill 601, which related to pharmacy benefit managers. This bill was introduced in response to the Rutledge versus PCMA Supreme Court decision. And the statutory changes will be effective January 1st, 2022. Under the law, the MIA's oversight authority for PBMs will be expanded to include jurisdiction over self-funded ERISA plans for several laws in Title 15, Subtitle 16, primarily those related to PBM reimbursement practices. Of note, the bill also removes the existing requirement for PBM contracts to be filed with the MIA for review, and it replaces that requirement with an informational form filing requirement. Finally, the bill requires the MIA to submit a report to the legislature by December 31st of this year on the scope of the Supreme Court opinion in Rutledge and also on how to apply that decision to the laws in Title 15, Subtitle 16. So we will be prepared to investigate applicable PBM complaints related to self-funded ERISA plans as soon as the law becomes effective. And we will also be revising our recently promulgated PBM regulations to conform to the new changes in the law. We will also, over the summer, be soliciting comments from stakeholders on their analysis of the scope of Rutledge's decision, and we will consider those comments as we draft the required legislative report. And commissioners, you want to add anything to that, Bill, or should I go on to the next one?
No, I think we're good. I think we're on to 638.
Okay. Yes, good afternoon. Senate Bill 638 amends section 15-103 of the Health General article. The Insurance Administration now has authority to investigate and examine administrative service organizations that provide specialty healthcare services. The examinations and investigations will review compliance with the requirements under 15-1005 to ensure that claims are paid in a timely manner. The findings of our investigations will be submitted to the Department of Health. In addition, the examination report will also be submitted to the Senate Finance Committee, the Senate Budget and Taxation Committee, the House Health and Government Operations Committee, and the House Appropriations Committee. Commissioner Birrane, is there any additional items that you wish to add to this bill?
No.
All right, thanks.
Okay, the next bill we have then is Senate Bill 3, which was the Preserve Telehealth Access Act of 2021. Now, as I'm sure all of the members of the health industry recall, there were several different telehealth bills that were debated during the session. And this was kind of what came out of all those, the combination of the different bills and what the General Assembly agreed on. So this bill was primarily intended to require some of the telehealth accommodations that were implemented during the pandemic to be continued for a limited period of time while the full impacts of telehealth are studied and evaluated further. So for insured plans in Maryland, those plans we regulate, the existing telehealth requirements that are described in 15-139 of the insurance article, they were modified to require from July 1st, 2021 to June 30th, 2023, coverage of audio-only telehealth conversations that result in the delivery of a billable covered health service. During that same time period, carriers will be required to provide reimbursement to healthcare providers for telehealth services on the same basis and at the same rate as if the services were delivered in person. There were several other revisions that were also made to 15-139, but in the view of the MIA, these other changes simply clarified existing requirements and did not actually alter the scope of the law. Further, there was some uncodified language in the bill that requires the Maryland Healthcare Commission to conduct a comprehensive study and assessment of telehealth with input from the MIA and some other agencies, and then report those findings to the legislature by June 30th, 2023. The MIA is specifically charged with studying how telehealth can support efforts to ensure healthcare provider network sufficiency, and also studying the impact of changes in access to and coverage of telehealth services under insured plans, and what the impact is on the ability of consumers to choose in-person services versus telehealth. And then the bill directs the MIA to consider all the requirements of the Act as we propose revisions to the network adequacy regulations that we are working on. So the MIA will be implementing the requirements of the Act as part of contract review, complaint investigations, and market conduct activities. We also plan to issue guidance in the near future on proper coding for telehealth claims in order to assist carriers in obtaining the information they need to ensure the provider reimbursement parity and also ensure uniformity in the data that they will be reporting to the Maryland Healthcare Commission for that study. So we have requested specific input from carriers on precisely what coding modifiers will be necessary to meet their needs, and we are waiting to receive that information before we will move forward with a bulletin on the issue. And that is the last legislative update.
Thank you very much, David. I think what we'll now do is let's walk through some of the more important bulletins from this year. I think you're going to kick us off with the PSAO regulation. Yeah. Bulletin 2107.
Exactly. So House Bill 978 from the 2020 legislative session, it established a regulatory framework for PSAOs that was intended to basically subject PSAOs to the same level of MIA oversight that currently exists for PBMs. So the MIA had posted draft regulations to implement some of those requirements back in September of 2020, but the regulations have not been formally proposed to date. So we issued Bulletin 2107 in March of this year, and the bulletin did two things. It established the application process and the filing fee for PSAO registrations, and it also provides interim guidance with respect to the form filing requirements for PSAOs. And that interim guidance will remain effective until the PSAO regulations are finalized. So on April 1st of this year, the MIA began accepting applications for PSAO registrations. And then by July 1st, 2021, all PSAOs that are currently providing services to independent pharmacies in Maryland must register with the MIA. The registration is subject to a $500 application fee, and it must be renewed every 2 years. Turning back to the contract filing requirements, effective October 1st, 2020, PSAOs were required to begin filing templates for their contracts with independent pharmacies, PBMs, and group purchasing organizations. The law does, however, provide that existing contracts that were enforced on October 1st, 2020, they can remain effective as long as the associated contract template is filed with the MIA on or before July 1st, 2021. So to date, the MIA has not received any PSAO contracts filed under House Bill 978. And the MIA does intend to pursue market conduct action against any PSAOs that we find are registered by July 1st, 2021, but who have not filed their contract templates. In the meantime, we will also be working to post a second draft of the PSAO regulations to the MIA website very soon. And as we do that, we will also post responses to the public comments that we received on the first draft. There'll be a shortened additional public comment period after the second draft. And then at that point, we will move forward with a formal proposal in the Maryland Register after we consider any of the additional comments we receive. And that's about it for PSAOs for now.
I think the only thing I would add is that for PSAOs to make sure that you do register, as David said, you'll be looking at a potential market conduct investigation or exam if contract forms are not filed. But if you do not register, you may be looking at an enforcement action. So if there are any questions or issues or concerns about who fits in, err on the side of safety, pick up the phone, call us so that we can help you with the registration process, and also whether you fit within the scope of the registration. And then I think you've got Bulletin 2113.
Sure, so I'm going to ask Mary Quay, our Chief of Life and Health Complaints, to discuss that item.
Yes, the MIA recently issued a bulletin to require licensees to use the licensee portal in ECTS when responding to complaints. The portal is secure, so additional encryption is not necessary. Using the portal removes some of the risks of email, such as going to the spam folder or accidental deletion. It provides a clear record of when a response is received and keeps the records together in the file. So that's why we are requiring the use instead of requesting the use.
Thanks, Mary. And then David, I think you're going to take us to the ever popular subject of network adequacy regulations.
Right, so anyone on the health industry on this call has been, I'm sure, very familiar with the network adequacy work. We have a lot of separate meetings and calls on that. So I just wanted to provide highlight a couple high-level issues with network adequacy. So the public work group last met on May 28th, and that meeting was intended to continue discussions of the draft proposed revisions to our network adequacy regulations. We have another public meeting scheduled for next week, Friday, June 18th. And this meeting will focus primarily on the role of telehealth in addressing network adequacy issues. And this is in accordance with Senate Bill 3, as we discussed earlier. And I do want to highlight, we did post some specific discussion questions to the website earlier this week. So we would certainly like to hear stakeholders' input on those items. And we'll continue to accept responses to those questions for a 30-day period following the meeting. Over the past several months, the MIA staff have met internally multiple times to consider all the public testimony we've received to date. And we've begun incorporating some of those comments into the draft where we've deemed it appropriate. Following the June 18th meeting, we hope to move forward with the next steps as soon as possible. And this will either be the release of another public draft version for further comment or formal proposal in the Maryland Register. And we'll base that decision on the type of comments we've received and how far apart some of the different stakeholders are on those various issues. In the meantime, the annual access plans are being reviewed in accordance with the existing regulations. And as we've discussed many times in the network adequacy meetings, there are some issues that the current regulations really lack specificity about the methodologies that should be used to measure the various standards in the regulations, also about the type and format of supporting documentation that is necessary for the MIA to complete its reviews. So this has resulted in a significant amount of back and forth communications that we certainly hope to avoid with the revised regulations. The next round of the annual access plans are due to be filed with the MIA on July 1st of this year. And we just want to remind industry that we expect the 2020 plans to address the comments and concerns that have been raised previously for the 2019 and 2020 access plans. And we expect the 2021 filings to include all the applicable information and documentation that has been requested in prior years. Providing this information in advance without us having to ask it will expedite the review of the 2021 plans and just make the process a lot more smooth. And that's all I had planned to say for network adequacy for right now.
At this time, I will move to a discussion of mental health parity. Section 15-144 of the insurance article requires carriers to submit reports demonstrating compliance with the mental health parity laws. The law also requires that on or before December 31st of 2021, the commissioner shall adopt regulations to ensure that the reports contain uniform definitions and methodology. To date, the administration has conducted 2 prior public meetings concerning the NQTL report in particular. Specifically, the administration requested public comments concerning the recommendations for the non-quantitative treatment limitations to review. At this time, the administration is focused on the specific methodology and definitions that will be required to satisfy the reporting requirements under the statute. We expect to hold at least 1 additional public meeting by the end of the summer. And with that, I'll turn it over to Commissioner Birrane.
No, I think we're good. I think our, as we've moved into regulations now, I think our next regulation is the Life and Health Guarantee Corporation regulations. Pretty straightforward, but I think David and Lisa, you were going to catch everybody up on the status of those.
Sure. So I can provide an update for everyone. The Life and Health Guarantee Corporation regulation, it is a regulatory change that amends the required notice regarding the Life and Health Insurance Guarantee Corporation coverage to conform to revisions that were made during the 2020 session. So Senate Bill 186 in the 2020 session made changes to section 9401 and 9414 of the insurance article and 19706 of the Health General article. The proposed regulation revises the definition of member insurer to include health maintenance organizations, revises some of the terminology used to describe different types of contracts, and updates the contact information used in the required notice. This regulation has been submitted to the Division of State Documents as an official proposal and will be published in the Maryland Register probably within the next month. And with that, I think David was going to talk about the annuity suitability regulations.
Yes, thank you, Lisa. So these regulations, this is a draft regulation that is intended to conform Maryland's annuity suitability regulations to the NAIC's Suitability and Annuity Transactions Model Regulation number 275, which was adopted by the NAIC in February of 2020. The draft regulations propose to adopt the NAIC model wholesale, and they're well aligned with SEC's Reg BI. And the regulations will require producers to act in the best interest of the consumer when making a recommendation of an annuity. The regulations also require insurers to establish and maintain a system to supervise annuity recommendations so that the insurance needs and financial objectives of consumers at the time of the transaction are effectively addressed. While the regulations will not define the term best interest, they will explain how to get there by satisfying obligations regarding care, disclosure, conflict of interest, and documentation. So we plan to post these regulations to the MIA website for a draft comment period of 30 days, and we do anticipate having them posted on the MIA website within the next month. After that, we intend to convene a public hearing following the comment period to discuss any stakeholder concerns. And we'll do this prior to then, after considering those comments, formally proposing the regulations in the Maryland Register. And with that, I can turn it over to Erica to discuss the use of registers regulations.
Thanks, David. So with respect to COMAR 3103.13, the revisions to this regulation were proposed to streamline the requirements for maintaining the producer register and to address what was perceived as overly burdensome documentation requirements for carriers. The proposed regulation was published in the Maryland Register on May 21st of 2021, and the comment period will close on June 21st of 2021. And at this time, I will turn it over to Lisa and David to discuss COMAR 310102.
Thanks, Erica. So I will briefly provide an update. The MIA is planning to propose changes to our emergency power regulations on an emergency and a permanent basis. Most of the proposed changes to the regulations at this time will actually relate to the property and casualty lines of insurance. However, there is one change in particular that will impact the life and health industry. When COMAR 31010206 was originally amended on the emergency basis back in March 2020, the MIA intended for the language to encompass any denials based on the treatment being unproven by any categorization. However, we recently realized that the use of the specific term experimental only may have implied a more limited scope than what was intended. Therefore, we are proposing a clarifying revision to COMAR 31.01.02.06F that adds the phrase or investigational to the provision indicating that the commissioner may require a health carrier to make a claims payment for treatment for a specified illness that the health carrier has denied as experimental. The regulations are on their way to ALR for review at this time. And with that, I'll turn it back over to Erica.
Thanks, Lisa. The next update involves the Producer Licensing Model Act and upcoming changes regarding line of authority name changes. The administration will begin implementing certain changes beginning in October of 2021, consistent with the Producer Licensing Model Act. Specifically, the names of 3 lines of authority will change. Variable life and variable annuity products will change to variable life and variable annuities. Health will change to accident and health or sickness. Credit products will change to credit. The name changes will result in various updates. Specifically, the updates will involve licensing examinations, available continuing education offerings, and how information is presented in the licensing record. The administration intends to issue bulletins to make sure that stakeholders are aware of the changes and the implementation dates. So at this time, I'll turn it back over to Nour and to David to discuss updates and reminders.
Thank you, Erica. I will discuss 2 updates and reminders dealing with annuity non-forfeiture interest rate changes, in particular the NAIC Model 805, as well as the non-forfeiture interest rate for life insurance that affects directly the valuation rate. On December 9th, 2020, the NAIC adopted an amendment to Model 805, which is the standard non-forfeiture law for individual deferred non-variable annuities, changing the non-forfeiture interest rate from 1% to 0.15%. This is not the accumulation rate. This is the non-forfeiture minimum interest rate that you have to apply when you compute the prospective and retrospective calculation, otherwise known as a 10-year test for fixed annuity products. So Maryland statute, I want to highlight 16504, particularly highlights the minimum guaranteed interest rate as 1%. That has not changed. So the question is whether you will file with the compact or you will file with the commissioner. For filing, for these type of filings with the compact, you will need to follow the compact's filing information notice 2021-1. That one was dated March 25th, 2021. It provides the guidance for implementation for ER2, Emergency Rule 2, that the Product Standard Committee recommended and voted by the committee to follow. Basically, what it requires is, it requires that for the companies who want to file a lower minimum non-forfeiture rate as permitted in the state statute and permitted by state law, to file that interest rate or non-forfeiture rate interest rate of 0.15% bracketed, meaning variable. But what the requirement, the compact requires, is the explanation for the bracketed information to state that the forfeiture rate will be no lower than the rate prescribed in the law of the state where the policy is delivered. Now, if you're filing with the commissioner, nothing has changed. You're not required to file if you already have a product in Maryland or meeting the non-forfeiture law of 1%. In particular, it's 16-504 that talks about the minimum non-forfeiture amount shall be an annual rate of interest that is equal to the lesser of 3% or a 5-year CMT rate that has to be accurate of no more than 15% before the contract's effective date. Obviously, no less than 1% if you're filing with the commissioner. Now, my second update will give you, it's the non-forfeiture interest rate that applies to life products and consequently does affect the valuation rate. So changes to the statutory non-forfeiture interest rate and valuation rate took effect January 1st, 2021. So effective this date, the standard valuation and non-forfeiture rate interest rate have changed. And of course, this affects the duration of 20 plus versus 20 less years of a contract. For 20 plus years, the maximum interest rate for valuation rate is 3.25%, and the non-forfeiture rate is 3.75%. The reason being is because the non-forfeiture interest rate floor in the valuation manual being removed. That's exactly section 3.A under the valuation manual, and the Tax Code Modification and Consolidation Appropriation Act of 2021 was passed on December 27th, 2020. What does this mean? Basically, again, if you're filing with the compact, they issued a guidance, and it's information notice 2020-1 that was dated November 19th of 2020. Now, if you're filing with the commissioner, of course, the choice is always to file a new contract with implementation of the new interest rate of whatever the maximum is, which is, following the non-forfeiture method. Now, as far as if you want to file alternate pages, scheduled pages, you need to file a specification page. There's a $125 filing fee per filing. And then we need to review the non-forfeiture values provided based on the calculations, as well as a revised actual memorandum. With that, I will turn it over to you, David, I think.
Sure, thanks, Nour. So the next item is the No Surprises Act, and I'm actually going to kick it over to Mary to go over the initial overview of the act, and then I'll come in with a couple points at the end.
Okay. So we do not have much of a substantive update on the No Surprises Act at this point. However, because the requirements of this federal law will require significant time and resources from both the state and industry to implement, we want to highlight some of the major provisions that industry should focus on from the NSA, as well as other insurance-related provisions from the Consolidated Appropriations Act of 2021. We also want to impress on industry that it is critical to begin implementation efforts for all of these provisions as soon as possible to ensure compliance by the January 1, 2022 effective date. Like the industry, the MIA is waiting for federal rulemaking to clarify many provisions of the Act, and federal agencies have a deadline of July 1st, 2021 for the first set of rules. We will be waiting to see these rules before making any major decisions on implementation. Legislation will be needed to give the MIA authority to enforce the provisions of the NSA, and any such legislation will need to address the interplay between the existing state balance billing protections and the new requirements under federal law. Since there are many requirements under the NSA that apply specifically to healthcare providers, the MIA will need to coordinate enforcement efforts and discussions with other state agencies, such as the Office of the Attorney General. Although the requirements that apply to payments to out-of-network providers and balance billing are the most well-known, there are other provisions of the NSA that will require preparation to implement. There are new requirements for healthcare providers and carriers related to provider directories. Carriers must have a verification process in place to verify and update the directory no less frequently than once every 90 days. If a member contacts the carrier about the network status of a provider via telephone, email, or other electronic web-based means, the carrier must respond within 1 business day. If a member relies on inaccurate information in the provider directory, the carrier is required to pay the claim at the in-network level, and the provider is prohibited from balance billing. Carriers must offer a price comparison tool via telephone and on their websites to allow members to compare the cost sharing applicable to specific services from different participating providers. There are various new disclosure requirements, including information about NSA protections that must be posted on carrier websites and included on each EOB for a service subject to the NSA. Insurance ID cards will be required to include deductible and out-of-pocket maximum amounts. Advanced EOBs must be provided within specified timeframes for all pre-scheduled items or services, with detailed information about benefits for the proposed service, including a good faith estimate of the plan payments and patient cost sharing. And I will let David finish on the No Surprises Act.
All right, thank you, Mary. So in addition to all the behind the scenes system changes that carriers will need to implement to comply with the No Surprises Act, insurance contracts will also need to be revised to comply with many of the new requirements. So due to the uncertainty around the future federal rulemaking and the fact that the effective date of the law is rapidly approaching, the MIA does plan to develop contract amendment templates to incorporate the NSA requirements into policies and certificates. And the hope is that this will help streamline the review and approval process of the contract changes. This will be very similar to what the MIA did for the early market reforms for the ACA back in 2010. So industry should be familiar with this. These templates will be communicated to industry via bulletin as soon as possible following the release of the federal guidance, which is, again, as we said, expected in July. And we are also requesting that carriers delay submitting form filings specifically related to the NSA until after the templates are shared with industry. Carriers will not be required to use the templates, but will be strongly encouraged to do so, especially for in-force contracts. And finally, one last item that we wanted to highlight is that the Consolidated Appropriations Act of 2020 also included requirements to analyze compliance with MAPIA. And these requirements have already taken effect. So of note, state regulators now have been given clear specific authority to request the NQTL analysis that carriers have prepared to comply with the law. And with that, we will turn it over to Brad Boban to discuss some actuarial issues.
Thank you, David. I just want to give a high-level summary of some rating issues that the Office of the Chief Actuary is looking at right now. We've received the ACA filings and they are currently under review. We expect to release the press release with the normal set of details by this coming Monday. A major driver for the ACA filings and for the non-ACA major medical filings has been COVID and making the appropriate adjustments related to COVID. In general, there have been 3 broad categories of adjustments the carriers have been making. The largest by far is to account for the big decline in utilization pretty much across the board, in all medical products and even in ancillary dental and vision products. There was a huge drop in utilization in 2020 in April and May, with utilization slowly coming back up to normal levels by third or fourth quarter. And making that adjustment has been the biggest COVID adjustment factor. There has also been adjustments for anticipated worsening of health outcomes due to missed preventive care in 2020. And finally, there have been adjustments related to anticipated future costs, primarily related around vaccines and assumptions with vaccine boosters. We ask that all carriers, when they're making these assumptions, provide as much detail as possible. On the utilization adjustment factors, a lot of carriers are giving us one annual adjustment factor, and we're really looking for monthly adjustment factors so that we can look at monthly PMPMs and normalize them for that utilization drop and still perform trend regressions. We'd like to see cost and utilization assumptions around vaccines. And so the more detail that can be provided, the better. COVID's also been impacting other lines of business like long-term care in different ways. In that market, there's been higher lapse rates. There's been a shift from facility site of service to home healthcare setting. And there's been a general decrease in morbidity, lower claims per 1,000 members. How that's going to have a long-term impact on long-term care is still uncertain at this point. And in general, there are other segments such as disability income where there's a potential long-term impact. And we're keeping a close eye on this, and any data that is available to share, is appreciated in your rate filings. Another good news about the ACA filings is the individual marketplace has seen, in general, quickly declining morbidity between 2014 and 2018. Morbidity worsened at double-digit rates between all those years. And with the implementation of the 1332 in 2019, things started to stabilize, and that rate of worsening greatly declined. And in the last 2 filing cycles between 2021 and 2022, morbidity is now basically flat in the individual marketplace. So, it indicates that this is now a mature marketplace with a stabilized morbidity. And one thing that we're looking at in relation to morbidity is how the impact of the American Rescue Plan could play into the future morbidity projection. And so we're very interested in emerging enrollment. The higher subsidies for the American Rescue Plan were live on the exchange's website on April 1st. So they're not going to show up until May enrollment. With the interaction with the expanded COBRA subsidies and just consumer knowledge about these new subsidies, we anticipate that a lot of consumers will not really be aware of the new subsidy level until later in the year and/or open enrollment for 2022. So we definitely want carriers to please consider and model what kind of morbidity impact new membership attracted by the American Rescue Plan could have. And then as a general long-term care update, in 2020, we reviewed a total of 44 long-term care filings. They were asking for an aggregate increase of 70%, and we approved an aggregate increase of 31%. 2022 year to date, we've had 12 filings asking for an aggregate 88%, and we have approved an aggregate 26%. Those approvals are greater than 15%. COMOR 34-1401 does limit the annual increase for long-term care to 15%. So any increase higher than 15% is phased in over multiple years. In total, these increases have impacted about 76,000 policyholders. And in general, we anticipate a continued high volume of long-term care filings, as the whole industry needs to get their blocks up to adequacy. There was a lot of problems with initial pricing assumptions. And we're continuing to review the filings thoroughly and taking into account all things, but both affordability for consumers and the need to have adequate rates able to cover these claims. And that's everything I had on the rating side. With that, I'll turn it over to Commissioner Birrane to talk about NIAC.
Thanks, Brad. Very much appreciated, and welcome, because this is Brad's first industry meeting, as I mentioned before, as Chief Actuary. So I'm sure everybody's had the opportunity to congratulate him on his promotion. But thanks.
Thank you very much.
So with respect to the NAIC, just briefly, what we wanted to do was make sure that you all were aware of the specific roles that we were playing, where we were taking more leadership role on certain groups and committees. And for myself, I'll just mention the Climate and Resiliency Task Force, where I'm a vice chair and I'm leading the solvency work stream. Many times we think of climate risk in connection with underwriting, and therefore we think of it in connection with P&C carriers, but we know that that is not actually the case. That's not the scope. That when we look at climate risk and its impact on companies, it also deals on the asset side of the balance sheet, a more developing scrutiny of investments, and frankly on the liability side, not with underwriting loss, but with respect to insurance companies as entities themselves dealing with D&O issues, shareholder suits, et cetera, depending on the entity. So that is a role that Maryland is playing a fairly large role in. And we are always welcome to hear both our domestic companies, local companies, and anybody writing in our market, their views and thoughts with regard to how the NAIC needs to adjust, improve, expand its financial surveillance with respect to climate risk, and what are the appropriate tools, what's really ready for prime time, what's still evolving and developing. And then the second group that I will be working on is the e-commerce working group that is under the Innovation and Technology Task Force. So that's a brand new working group that's been formed specifically to look at the ways in which companies are impeded in their efforts to utilize technology in just a variety of ways, oftentimes because either a state hasn't adopted the Uniform Act or it isn't applying it in the same way, or sometimes, frankly, even with the NAIC's own instructions or guides, there may be a misunderstanding. For example, one of the issues that really came to the front because of COVID was the instruction in the NAIC's guide with regard to wet signatures on blanks. And that really, honestly, wasn't based in law anywhere. It was really an instruction that had been there for a long time. And with questions coming up from industry and after several discussions and meetings, we were able to get clarification on that. We were able to have it changed. So that led to a number of discussions about other areas where there are some concerns. And that is something we want to make sure that you guys are attuned to as well, and that you let us know places where, whether it's Maryland or whether it's other jurisdictions, there's practical difficulty getting stuff done because of an inability or an unwillingness for regulators to accept the use of e-commerce and technology. And with that, I think I know David and Mary and Erica also have some of the committees that they are focused on to share with you. And Joy probably as well, although I don't see Joy's stuff on here, but I would invite Joy to mention hers as well.
Sure, I can just start real quick with the, I just wanted to highlight that the Health Insurance and Managed Care B Committee, that Maryland is a voting member, and that's a committee we are very much engaged in. At the upper level of the full B Committee, there hasn't been a lot of work done recently. It's more issues that are flowing up from the subgroups and task forces. And Mary will actually talk about a few of those groups in a second. But just it is a group we're very involved in. We're constantly engaged with the federal government at that level and implementing, various, federal requirements and how that interacts with the state, regulatory regime. And that's just a committee where we are very pleased that we've been able to be on that committee for several years now. And we're really pleased with what the communication we're able to get with other states and our work we're able to do there. So again, I'm going to defer the specifics of some of the task forces and subgroups. Mary can talk about two of the subgroups that she's on currently.
Thank you. Yes, I am on the Pharmacy Benefit Manager Regulatory Issues subgroup, and Maryland is a voting member. And the subgroup has completed work on a draft model act for licensing and regulating PBMs, and it is before the full B committee for approval. And the next meeting of the B committee is June 22nd. The other I'm involved with is the Consumer Information subgroup, and I chair that subgroup. The Consumer Information subgroup is working on developing a series of short explainers on topics related to health insurance, such as how to file claims or file an appeal, and other topics related to those processes. And I think then, David, are you the IIPRC?
That's Nour.
Nour, okay.
Happy to provide update. Maryland is a voting member on a product standard committee, and we worked heavily on the updates for the annuity that I just presented earlier, annuity non-forfeiture changes. So we are a voting member on product standard committee, and we have meetings every other week. The minutes are public, both public calls and regulators' minutes are public on the Compact's website. The Compact does post often information updates on, they call it weekly tips, so weekly updates. The latest one has to do with term products and non-forfeiture interest rate changes that I thought was on target. Commissioner Birrane is the chair for the audit committee also. And as far as the joint committee of the Joint Commission, Interstate Commission with the Management Committee, we actively participate. And those meetings, I think, is about 3 months or so. As far as NEIC, we actively participate on a committee, in particular the annuity suitability update model, which has passed. We served, I think, for 2 years as voting members to complete that model, Model 275. And I think Lisa gave update on as far as regulation is concerned. And we also served as voting members for the annuity disclosure, and that's Model Regulation 245.
Thank you, Nour. Erica, were there updates you wanted to provide?
Only to mention briefly that Maryland is part of the MAPIA work group, which is through the B committee, which has really been a valuable source of information and collaboration with other state regulators relative to the reporting requirement that I discussed a moment ago under section 15-144, where Maryland is in the process of working through the development of regulations. We're in close contact with our fellow regulators so that we can ensure that our ultimate regulations are informed by the work that's being done in other states. So that's been a valuable opportunity. With that, I'll turn it back to you, Commissioner Birrane.
And Joy, do you want to mention the committees that you're most active in, particularly the senior issues? You're on mute.
The one that I do want, thank you, Commissioner. The one that I want to focus is on the senior issues one. And that is an opportunity for those of you that aren't aware, basically for various states and also consumer representatives to bring to the attention of everyone either issues or new products that are being introduced to our senior community. And that's a way for us to make sure that there aren't unintended consequences for these individuals. And so it's one of those groups that I would invite anyone, if you have some time, just to attend one of the meetings to find out more about what's going on for our seniors.
Thanks, Joy. I appreciate that. Anybody else on the MIA team that wants to mention Any of our NAIC activities? We're pretty busy. You know, I'm on the executive committee. I'm the treasurer of the Northeast Zone. So, you know, we have a pretty full agenda when we're there. And we're always happy to hear offline things that, you know, folks that are operating within our state want to bring to our attention, you know, in our various roles at the NAIC. And I think the other thing that we wanted to mention, you know, our dates are kind of moving at the moment, but as you all are aware, we have been holding listening sessions. They have been focused up to this point primarily on what I would say are life and health issues, but they will not be exclusively life and health issues. But Joy, do you want to talk to the next two that we have coming up?
Sure. So first of all, at the end of this month, we are going to be having basically a session that's going to be devoted to financial security of our LGBTQ plus community. And we're looking really at life products and disability products and issues and concerns that that community has when either they're attempting to learn about or gain access to those products. So that'll be at the end of June. So any of you that would like to speak at this particular session, please go to our website and sign up. We'd love to hear from you. Then we're going to have one probably in the beginning of the fall or very late summer that's going to be focused on issues that are particular to rural Maryland, because we all know that issues sometimes that occur in our urban areas are very different than issues that address people that live in our rural communities. So we're going to really be focusing on that. And then later on in the fall, we're going to be doing something just a little bit different, talking more and listening to what types of products are actually being made or not made available door to door. So, I mean, we hear sometimes that, I know years and years ago, people would have people knocking on your door, selling you life insurance and things like that. And that's the way I think our parents and our grandparents were used to doing business. But now that we're in this sort of new era where everybody is online, what opportunities or losses of opportunities are there? So that'll be the focus at that point in time. I mean, as the commissioner indicated, these listening sessions have been an excellent opportunity for us. And we just look forward to your participation and just to get more information that we can help our consumers. Thank you, Commissioner.
Well, thank you, Joy. And, you know, I think what's come out of the session so far, it's not as though it's driving, you know, like you're going to see a legislative request or necessarily, you know, something legal or some new enforcement type action. Oftentimes, what it's helping us to do is look at ways to educate consumers. Oftentimes, we find that the places where consumers are upset and frustrated and concerned are in situations where they're not really fully aware of what their options and what their rights are. So that has led us to, for example, very detailed, educational session that we just had on health insurance. And what do you need to think about when you're looking for health insurance, and how do you utilize that product afterwards? It also has helped inform and will continue to inform conversations that we'd like to have with carriers about sort of next generation type products that, you know, we do not, we're not the creators of that. We're not the creators of products. That's not what we do, but we can certainly talk and work cooperatively around sort of joint goals to improve the experience of Marylanders with regard to the kind of products that are available for them through the private market. So I agree with Joy. I think it's been very educational and very helpful to everyone. And most importantly, it's given people who often don't feel heard the opportunity to be heard. The other thing that I would point out is, Joy, I don't remember the date that it is in July, but I also believe that we have on our schedule the meeting that we will be having to give folks who are mental health professionals the ability to talk about the experience that they relate about not being able to get credentialed, but then being asked to do single cases. And so this has come up in several meetings, either in the context of MAPIA regulation hearings or in the context of network adequacy regulation hearings. And what I did was I said, okay, I keep hearing this, and I keep hearing sort of stories without details, and we only have one complaint. So we're going to give you the opportunity to tell us what the experiences really are, so that we know whether this is one thing that's occurred one time or 10 times and been repeated 100 times, or whether this is a much more common occurrence, and whether this is sort of these are one-off events that occur that don't really reflect company policy. That's often the case, where someone who's dealing one-on-one may be relating something that's not necessarily accurate if you took it up a few notches within the company, or if it's something else. So we just want to we want to put this issue to rest as much as we can. And to that end, we have a hearing coming up, or a town hall coming up. And when is that, Joy?
I need to double check the date. I believe it's July 28th, but I will double check the date and we'll put it in
our website. Well, thank you. Thank you very much to all the members of the MIA for their comments today. And hopefully everyone found it to be valuable to them. And we do have 3 individuals who have registered to speak today, and we'll just take them in the order in which they registered. And then afterwards, I think we will probably have time to take some questions. So let's start. Matt Celentano, who's the Executive Director of the League of Life and Health Insurers. Matt, happy to hear from you.
Good afternoon, Commissioner Birrane and MIA staff. Thank you very much for the opportunity. It's always great to be collaborative with all of you. I have 3 questions that I actually sent over to you guys prior, but I'll just sort of knock them out. The first one is not really a question as much as sort of a comment or heads up. As you guys know, the American Rescue Plan Act created subsidies for COBRA. And the IRS released an FAQ a few weeks ago, which sort of acknowledged the fact that there might be some conflicts. The federal statute would say in the case of an insured plan subject solely to state law with respect to a requirement to provide continuation of coverage, the premium payee is the insurer providing the coverage. And then it goes on to say that the requirement may create administrative issues. And as you all know, and for the state, we require the insurer to pay the employer. So there's a direct conflict there. And we are concerned that before this gets cleaned up, that you might actually see some complaints. So through no fault of anybody's own, there's just an administrative burden created by the federal action. And I was wondering if there had been any thought put into that, or if the MIA has any solutions they might be able to bring forward in bulletin, reg, whatever.
Do you want to start, David? I mean, we have been talking about it.
Sure. Yeah, I mean, so thank you, Matt. We were aware of the issue, and we have looked at it, and we've discussed it at the NAIC level, even with the feds when they've been on the calls. So we are aware of it. We certainly understand the issue and that it is an administrative burden. At the same time, we don't feel that this is an insurmountable burden that is in any way going to prevent Marylanders who are only eligible for state continuation, but do fall under the definition of assistance eligible individual under the federal law, from actually getting the COBRA coverage free of charge, or state continuation coverage, I should say. So we certainly understand there's going to be an additional level of accounting between the employers and the insurers, which would be, we'd all like it to be easier. And we understand there's going to be difficulties there, but we feel the law is pretty clear that neither an employer nor an insurer can basically require one of these assistance eligible individuals to pay the premium for the continuation coverage. They have to be treated as having paid it. And then the law clearly says in these situations that we're talking about that the insurer will be eligible for a tax credit. So it's just, there's going to have to be that, unfortunately, until the feds clean it up, there's going to be that additional level of administrative accounting between the employer and the insurance company. And we haven't seen as there being anything that we can do about this, since it's the federal law and the feds are administering the subsidy or the tax credits and everything. But again, we are involved at the NAIC level, and we have, anytime the conversation comes up, Maryland is one of these states where it is an issue, and we are communicating that with the federal government.
And Matt, if there's something specific, like, the language of the statute that talks about an employer payment versus the insurer crediting the employer's account, that you think is a particular problem or an impediment, I think we have the ability to look at our statute and how it is appropriately interpreted in this circumstance. So, I don't think that that's going to be the impediment, is, those words. So if there's something precise and specific that, the folks are stumbling over, that they particularly, want guidance on, then propose that question and see if we can help you with that. Also, to the extent that, it's helpful for us to talk to, any of the TPAs or major TPAs, we're always willing to do that as well.
Much appreciated. Thank you. We will certainly get back to you. Can I proceed to question number 2? Okay, thank you. Question number 2 is more of a follow-up to a discussion related to your guys' bill, Senate Bill 226. And a few days before, I don't actually remember if it was a couple of days before session started or right in the beginning, because we started so early this year, I had approached Mike Paddy and team members about the potential for what we saw as friendly amendments to extend the bill to not only electronic communication between yourself and consumers, but also to extend that between carriers and consumers. And this was sort of on the tail of trying to modernize the communication that we've been doing. And then postal delays started and all kinds of, we just see the consumers are trending in that direction where they want to have as much of their communication done electronically. And we were curious, at that time we had talked about not in the bill, but continuing that conversation after session and trying to find an appropriate fix. And I think you addressed it earlier in the agenda, but Jennifer Nito, who should be on this call from Delta Dental, wanted to give a couple of real world examples that might maybe assist in your deliberations. So I'll kick it over to Jennifer. Thank you.
Great, thanks Matt for that primer, and thank you Commissioner and staff for allowing me to speak about this topic. So expanding on Matt's comments, this is an idea we've been mulling over for a few years, as encouraging more enrollees to receive their notices and documents electronically is much more efficient in terms of delivering promptly and securely. And then additionally, electronic delivery reduces, of course, environmental impacts and administrative costs. So we really believe that this would lead to a greater uptake in dental benefits by more employers and employees. Insurers, and specifically Delta Dental, were interested in gaining more flexibility to increase our use of technology to communicate with our enrollees. Right now, it's difficult to get those enrollees to click a link to register. Oftentimes they just don't read the fine print. They're not really interested in signing up for paperless communication. So we were interested in doing this certainly before the pandemic, but everything that we've experienced with the pandemic this past year really increased our interest in this topic. And we were further prompted to inquire specifically in Maryland after the issuance of Bulletin 21-08, which encouraged insurers to, among other things, use electronic means to deliver notices and billing information in order to supplement paper mailings as a result of the USPS mail delays. So this theme of allowing more flexibility in using electronic means to deliver important notices and documents is cropping up really around the country. I'm not sure if it's a result of the pandemic or a more general modernization of several insurance departments. For example, the Arizona Department of Insurance sponsored legislation this year that allows the department to communicate electronically with insurers, and then also allows electronic delivery of insurance transactions by insurers to enrollees, unless that enrollee specifically elects to receive a hard copy. So there seems to be a nationwide discussion on this issue, particularly this year. There's also a bill in Texas, which gives plan sponsors the ability to opt in their employees, and it gives them a specific, on an individual basis, to opt out. So that's really what we're looking for in terms of legislation. Of course, we appreciate and are encouraged by the enactment of SB 226 in Maryland, which Michael summarized earlier in this meeting, as well as the NEIC e-commerce or e-communication work group, which I know is going to start meeting in July. So we think both of those things really highlight the great inroads that are being made in terms of communicating electronically with regulators. And we're hoping that that success in that type of communication will be expanded to include communications between insurers and their enrollees, just given the difficulty we face in getting those enrollees to sign up for electronic delivery. So just given this information, our general high-level ask today is whether the administration would be open to adopting something formal in the future, or maybe even just having further conversations with insurers on this specific topic.
So I guess what I would say is that, you know, we at the MIA clearly value the movement to electronic communications for a variety of reasons. I think that COVID made it just that much more clear how important it is to be able to have an alternative means of communication. And, you know, we all know that there have been continuing problems with postal delivery, et cetera. Having said that, and I will also say, obviously on the P&C side of the world, there are statutes in place now that do provide for opt-in for you know, electronic communications. I will tell you that it's a conversation we're happy to continue with you. I think that the General Assembly has indicated pretty strongly that they want to be very thoughtful about assuring that consumers have the ability to opt in as opposed to just opting out or being forced. And part of that, and particularly with, I would say, health-related products and medical products, is the concern that while many of us have the ability to participate and to do things electronically, not all of us do, and not all of us have the same skill set and skill level. Not all of us live in areas where even, you know, broadband or, you know, wireless communications are as reliable as or even exist in some places. So I think that the idea of having kind of mandates on that issue is something that we would not support as an agency at this point. And I don't see that being something that the General Assembly or the true policymakers here would support. But I certainly think that there's a lot of room for conversation about where we can encourage people and give people, you know, better options, and we can continue to adjust our statutory language to build those options in so that we can move away from statutory paper requirements, even as between consumers and you know, and companies where there's optionality. Mike, you probably want to address this as well.
Sure. You know, Kathleen, I think you covered it. You know, Jennifer, Matt, I would be curious to see, you know, what Arizona and Texas actually put into their law, just to see, you know, how all the dots connect. But other than that, you know, Senate Bill 226 obviously was amended based on a voting session in Senate Finance to incorporate clarity that Senate Bill 226 was between the MIA and licensees. So we're always open to talk about something, but I think Senate Finance, you know, had their own interpretation of what we were trying to accomplish.
Well, and one of the things that they did, I mean, there's a part of the bill that's very specific about that we can mandate licensees to communicate electronically and to accept electronic communication as the equivalent of, you know, any other methodology, including paper. With regard to non-licensees, you know, to Mike's point, one of the things that finance in particular was concerned about was that we did not mandate that, and that it would only be in those circumstances where, you know, the consumer had provided us, the non-licensee had provided us with that type of contact information, so that it was really more of an opt-in process. And I think that's a fairly strong statement of where they are around forcing electronic communication versus the circumstances, and they're willing to allow it.
Sure. Thank you. Yeah, and we definitely align with many of the points that you made. Certainly don't want to mandate or force anyone or consumers or invade any consumer privacy laws, but very excited for more conversations on this. And thank you so much, Commissioner and Mike, for speaking on this topic.
Absolutely. Thank you, Jennifer.
Okay, last one from me. Thank you for appeasing me, guys. The last question is, has the MIA had any further thoughts on modifying the producer licensing examinations and specifically the use of one-part exams? I know that ACLI started to have discussions with the MIA in, I believe, the end of 2017 and 2018. And since then, Maryland has become basically one of just a handful of states that have not switched from the two-part to one-part tests. Now, we had put in a bill in 2000.
Matt, yeah. Let me stop you, because we're going to make you so excited. And I'm going to let Erica carry the message.
All right.
Yes, the short answer is yes. So that issue landed on the agenda for the Producer Advisory Board again this past year during the pandemic emergency. And yes, we are in the process of switching to a one-part exam. We are working very closely with a variety of vendors to ensure that that rollout is very smooth and that all of our various stakeholders are aware of the updates and the changes. Tentatively, we are looking at October. But certainly as we gel the date, we will be providing updates and notices to various stakeholders.
Well, thank you. Thank you very much. And Michelle Foster, who's here from ACLI, was going to go through a bunch of stuff, but you should say thank you too, Michelle.
Yes, no need. I will not say anything further, but while I do have you all, I do want to thank you not only for this, but also for moving forward with the revisions to the annuity suitability model. As you know, this has been a top priority for ACLI, but not only ACLI, a joint trades coalition of industry that have been really pursuing, adoption across the country. And hopefully we look forward to Maryland possibly being the 13th state, depending on how fast this goes, to adopt the model. And again, here to offer, any assistance, if you have any questions, or just be a resource to you all as you navigate your way through the process.
Michelle, this is Nour, Commissioner. If I may add, I know you guys are active on the next chapter, which is the Q&A as a guideline to states. And Maryland has been actively participating in that continuation after the model has been adopted. So I encourage you to please, the hurdle, as you recall, was not included in the definition of best interest standard that has been supplemented, as David presented, to the 4 categories being met. But please continue to participate on those Q&A documents. It has not been finalized. It's almost there, but it's extremely helpful to hear from ACLI, and your input is invaluable. Thank you.
Yeah, thanks, Nour. And we have been participating, the joint trades group that I referenced in the FAQ process. And, just mentioning the use of best interest or it being defined, that is definitely something that we feel is clearly defined as is. It clearly outlines the steps you have to take to act in the best interest of a consumer, and has definitely been something that we've been encouraging and definitely insisting on in states that have been considering adoption, or, kind of looking to go in a different direction without that, the use of best interest. So, I would just end saying that, we definitely support, insist on the use of best interest, and happy to talk to you if, there's any information or additional clarification that we can provide of why that is so important.
Great.
Thank you, Michelle. We appreciate that. And, obviously, as David and Nour had indicated, we will post them on our website first for public comment, so that, folks who have issues with the way the model came out can, make their concerns known. And we will then have a public hearing. So to the extent, if we get comments. So if we don't get comments, we won't have a public hearing. We'll just, go ahead with them. But if we do get comments that are other than supportive and we have a public hearing, then, we will look forward to your participation in that public hearing.
Yeah, I suspect you'll get many comments and we'll be there.
Okay. Thank you.
Thank you, guys. I'm done.
All right, awesome. It's always good when we can close up with we were able to provide something that was that you've been looking for a long time, that I think is a win-win and very practical for everybody. So that's terrific. I wanted to invite anybody else who is on the call but in the non-panelist part to raise their, well, you can't raise your hand, but you can type in the chat function that you'd like to be heard from, and we'll either move you over or we'll open the mic so that you can speak. As I'm looking through the chat box, I can see that there may have been a couple of comments and questions. We will respond to those offline unless you want us to, unless you want to come on and talk about them now, or if you have anything else. So I'll give folks just a minute. Okay, well, not seeing anything here. So I believe the two individuals who posed specific questions that are in the chat box, we will respond to you. Craig, do you have the necessary contact information? Are you able to identify who those folks are?
Yes, I should have their emails.
Okay, that's great. So we will touch base with you on those issues. And if there are things of broader concern that others that warrant a bulletin or a consumer alert, we'll address that as well. But we will definitely circle back to you. And not seeing any other people who've indicated that they want to speak, I think that brings us to the end of today's Life and Health Industry meeting. Anybody else from the MIA that had anything that they wanted to add? Okay, well, thank you very much to my incredible staff for today's presentation. And I thank industry and others in the chat room for your thoughtful comments. And just as a reminder, the recording of this virtual hearing will be posted to the MIA's website shortly. And with that, we'll just call this one a wrap and talk to you all soon. Thanks.